We take every transfer very seriously and we analyze every cycle. So yes, we're looking at many things after every cycle that is not successful. But we always look first at the quality of the embryos, at the endometrium, the uterine lining, and other parameters such as the woman's age, the spermiogram of the gentleman. There is one thing, though, that I should mention at this point. 1 or 2 failed transfers don't really mean that you have no chance. So it's important to have patience and to keep fighting as long as the options are there, as long as the embryos are vital and fit for transfer. However, whenever there's many possible 4, 5, 6 transfers without success, and it's actually labeled RIF, repeated implantation failure, which is a diagnostic unit in itself, here are some of the parameters that we look at. Just very briefly, it's genetics, hematology, immunology, and possibly hysteroscopy. So as far as the genetics go, we look at the embryo development, and especially if the embryo development is poor, not as expected, it's a good idea to have a blood test performed in both partners for karyotype and possibly some other abnormalities, eventually consulting with the geneticist. Not always 100% necessary, but advisable. The karyotype test, however, might be a very good idea. Number 2, hematology. Blood clotting can play an important role in the nesting process of the embryo, so whenever there are repeated implantation failures, it's a good idea to examine these factors, and you can discuss them with your gynecologist or hematologist eventually. Immunology, that's a very wide and complex field, but yes, the immunological processes in the organism of the woman can play a role during the nesting process, and it's a good idea once again to discuss either with your physician, with your gynecologist, or with a reproductive immunology specialist. And of course, when there's multiple failed transfers, a hysteroscopy is advisable, an examination when the uterine cavity and its integrity is checked, and eventually chronic endometritis can be diagnosed and treated with antibiotics. So once again, this is a rather complex process, but it's important after a failed transfer to take the time, go through these, and fill in the blanks to be ready for the next transfer in the best possible way.